This presentation about rickets is by Meg Hunt, Brittany Jordan, and Tasha Doty. What is rickets? Rickets is the softening or weakening of the bones in children, mainly caused by a lack of vitamin D, but can also be from the lack of calcium or phosphate. Vitamin D allows the uptake of calcium to be properly used by the body. It is rare in the U.S., but is much more common in developing countries where malnutrition is prevalent. This is a picture of normal bones versus ricket bones. Rickets bones are usually bowed out, weakened, and more prone to fractures. How long has rickets been around? Well, in the 2nd century, there was documented descriptions of individuals with rickets. In the 1640s, the condition was also well documented as a common bone problem all throughout England. However, the scientifically proven cause of rickets was not clearly understood until the 1920s. By the 1930s, public health initiatives were being recommended to fortify milk with vitamin D. This led to a large decrease of rickets in the United States, as well as in other developed nations. The risk factors for rickets are children 6 to 24 months old, who are most at risk because their bones are growing at an extremely rapid pace. Dark skin is another risk factor because it does not react as strongly to sunshine as does lighter colored skin, causing less vitamin D to be produced. In addition, children who live in locations where there is less sunshine are at higher risk for rickets. However, this is not always true because children in hot desert countries such as the Middle East may be bundled up to prevent sun exposure, also leaving them susceptible to rickets. Certain types of anti-seizure medications appear to interfere with the body's ability to use vitamin D as well. And lastly, exclusively breastfed infants not taking additional vitamin D supplementation are also at risk because breast milk does not contain enough vitamin D to meet their dietary requirements. What are the types of rickets? They are nutritional, which is a lack of vitamin D in the diet, vitamin D resistant, which is a genetic condition that causes a resistance to vitamin D, vitamin D dependent. Type 1 and 2 are both rare autosomal recessive disorders that cause hyporesponsiveness to vitamin D. Type 1 does not respond to vitamin D, while type 2 does respond to exogenous vitamin D doses. And lastly, there is congenital, which is due to maternal malnutrition. What are the signs and symptoms of rickets? They are bone pain or tenderness, dental deformities such as holes in the enamel, increased cavities, and even just a delay of teeth formation. Impaired growth, increased bone fractures, muscle cramps, short stature, skeletal deformities, and in severe cases, seizures. What are the skeletal deformities? Well, a bony necklace, otherwise called a ricketic rosary, is a swelling of the costochondral joint that appears in rickets. Spinal deformities such as scoliosis or kyphosis, bowed legs, and increased bone fractures. In addition, there is also a delay in closure of the bones on the baby's head, causing a soft spot to remain after 18 months old. How do we diagnose rickets? Rickets is diagnosed clinically with a complete medical nutritional history along with a physical exam. If rickets is suspected, x-rays of the long bones and ribs are taken. Along with that, labs are taken to measure vitamin D levels, alkaline phosphatase, parathyroid hormone, which is the hormone involved with calcium and phosphate levels, as well as measures of kidney function such as BUN and creatinine. Labs will show low calcium levels, low phosphorus levels, and an elevated alkaline phosphatase. What to look for on x-rays. Usually x-rays show signs of rickets before clinical symptoms are even apparent. The distal radius and ulna are the most common place to find these bone abnormalities. The ends of long bones lose their sharp outline and begin to appear fringy and cup-shaped. Since the ends of the long bones become non-calcified and radiolucent, the distance between them appears increased. The bone matrix elsewhere also becomes more radiolucent. Due to a weakening of the bone shaft, the bones begin to bow out, usually in the femur. There may also be lots of little fractures that are apparent on the x-rays. So how do we treat this? Well, usually treatment consists of dietary changes, increasing dietary intake of calcium, phosphate, and vitamin D. Also, increased exposure to the sunlight. Exposure to UV light for about 15 minutes per day is adequate enough to supply enough calcium and phosphorus in the diet to prevent rickets. In addition, supplementation may be helpful. For infants and children, 400 units of vitamin D per day is recommended. And where can we get vitamin D? The body itself makes vitamin D when it's exposed to the sun. In addition, cheese, butter, margarine, vitamin D fortified milk, fish, and fortified cereal are all sources of vitamin D. So how does the sun give us vitamin D? Well, this picture here is the pathway of vitamin D activation. Put simply, the sunlight activates a precursor to vitamin D under the skin, and the liver and kidneys produce the active form of vitamin D, which then transports the calcium. Prognosis. If diagnosed early, rickets has a great outcome. Calcium and vitamin D supplementation can heal bone deformities in weeks to months. Long-standing rickets may heal over the course of years or may possibly need surgical treatment. How can we prevent rickets? The key to preventing rickets is patient education. An expectant mother should be told to take prenatal vitamins and also be told about supplementation of vitamin D if they choose to exclusively breastfeed their babies. Also, sunlight exposure causes the skin cells to produce vitamin D, so parents should know to get the kids out of the house to play. 400 units may be a sufficient amount of vitamin D in non-pregnant patients. Wait, doesn't this sound like osteomalacia? Isn't rickets the same thing? Yes and no. They are the same because they both involve softening of the bones due to vitamin D deficiency. But they are different because rickets is the term used for children, while osteomalacia is the term used for adults. These are the references for our presentation.